How are you doing today? That's fantastic. Are you here for an appointment? Oh, that's right. I do remember speaking with you earlier today. Yes, yes. I know with the weather today and the terrible storm outside, we've had a few cancellations. Yes, so we were able to squeeze you in the last minute. Yes. So, you've never been here before, correct? Okay, so I'm going to need to take a few details from you and get it into our system to start a profile for you so that I can give that to the doctor. Okay, fantastic. One moment. Okay, so first of all, I'm going to need your first name. Okay, and your last name. Can you spell that for me, please? Okay. Okay, perfect. And your date of birth? Sure. Perfect. Okay, and can I get your phone number, please? A daytime phone number will do. Yeah, cell's fine. Okay. Okay, perfect. Okay, and can I get an emergency contact? Okay. Okay. Okay, and can I get their phone number? Yes. Okay, perfect. Okay. Perfect. Now I'll just get that to print off. In the meantime, I will get you just to sit down in the waiting room, and the doctor will be out to get you in a moment. Yes, right over there. We have a lovely seating area that you can sit down in and help yourself to a glass of water over there if you'd like. Yes. Yes, I'll be right with you. All right. Yes. Okay, so what I understand from your file is that you want to take care of some of the fine lines and wrinkles that you've got going on. Okay. Alright, well, as you know, there's a few different treatment options that we have for taking care of these sorts of things. But from the looks of it, you don't need anything too complicated. So let me just get my gloves on and I'll take a look at your skin a bit closer, and then I'll tell you what I think the best course of action should be. Alright, great. One moment. Alright, so let's see here. Okay, let me get a little bit closer. Okay, alright, so I see there. Okay, well, it looks like you don't have anything too serious to deal with. So I'm assuming that the areas that you would like to deal with most are the nasal labia folds down here. Yes, and some of the wrinkles just up here in the forehead. Yeah, so what we can do for that is we can do some Botox injections up in the forehead, and then we can do what is called Juvederm, and that is a filler around the nasal labia folds. Yes. Yeah, absolutely. So how it works, what we're going to do is, what we want to get rid of first is, if you make a frowny face for me, so can you go like this and put your eyebrows in? That's right. So these little lines here, right here and here, yes, right there. Yes, those we want to get rid of. So we're going to put some injections just around that site. Correct. To relax those muscles. The more relaxed they are, then the less ability you have to make this, and then the wrinkles aren't going to appear. Correct. So now the next section that we're going to target is called the corrugated muscles. Oh, sorry, that's what we just did. The frontal muscles. And so yes, so what we're going to do is you're going to go up, eyebrows up, and see these wrinkles up here? That's right. Right up in here. Right there. That's right. So those ones we're going to get rid of by putting some injections just around up there. That's right. So we'll use approximately 16 units for that area, but it's not painful at all. No, we're going to use a topical anesthetic, so you're just going to only feel like the slightest pinch, possibly like a mosquito bite or small bug bite. Yeah, you might not even notice it. Alright, and now for the Juvederm, so around the nasal labia folds, what we're going to do is we're going to make sure that we put the injections in so that it fills out nicely. Yes. Yes, you see those results absolutely immediately. Yes. Absolutely, I can discuss the pricing with you. Of course I understand, sure. So, let me just take off my gloves here. Okay, I'll toss those. Okay, so let me just pull them up on the computer and we'll do some calculating to figure out exactly what it's going to cost for you. Yes, okay, 1 second. Okay, so like I said, I believe that for your face, what we're going to need is about 16 units maximum for the Botox. Here at our clinic, we do Botox at $15 a unit, so let me just type that in here to the invoice. Okay. And then for the nasal labia folds and the Juvederm, what we're going to do is use 1 syringe per side. And each of the syringes costs $550. It's a bit pricier, though the results are much more effective for those deep, deep wrinkles, and it lasts much longer. So it'll last about 6 months, while the Botox lasts about 3 to 4 months. Right. So... okay. Alright, so it looks like it says here, the cost before taxes are going to be $1,350. Yes. Yes. Absolutely. If your private coverage insurance will cover it, then absolutely we can put through the paperwork for you. Alright, sure. Let me print that for you. 1 second. Okay, and your insurance provider is? Okay. I'll just let that print. Yes. Absolutely. Sure. Actually, we can do the procedure for you right here today. Yes, it only takes a few minutes, and then you're right out the door and can continue your day. Sure. Okay, absolutely. Well, we'll just print off this paperwork for you, and then I'll let you get settled in to fill that out just down the hall in the examination room. Yes, we always do a pre-examination for any brand new clients, no matter what procedure they're getting, and then we'll do the examination again if you decide to do any more complex procedures. But for right now, we're just going to start with the one examination today, and then you should be good to go unless you decide, you're interested in another procedure that would require anesthesia or something like that. All right. All right, great. So if you want, you can follow me down the hall, and then, yes, just to the examination room. All right, great. Okay, great. So I'm going to add the insurance forms into your file here, and we'll set those aside. All right, great. Okay, so before we get started, I'm just going to let you know a little bit about what we're going to do with this assessment. Yes. Okay, so first of all, what we do is what's called a cardiovascular assessment, and then we're going to do a respiratory assessment. Correct. Yep, and then I just have a bunch of questions to ask about your general health. Yes. Yep, nothing too tricky, I promise. Okay. All right. So let me get this up and started here. Okay. Okay, so we're going to start with the cardiovascular assessment. Yeah, it sounds a lot scarier than what it really is. Yes. Yeah, I promise. It's nothing too fancy. Just a big fancy name. So just have a few questions for you. So, have you ever had or do you currently have any of the following? Okay. High blood pressure? No? Okay. Palpitations or an irregular heartbeat? Okay. Heart murmur or rheumatic fever? Okay. Pacemaker? Okay. Any other heart disease? Okay, before we move on to the respiratory assessment, I'm just going to take a quick listen of your heart. Yep, okay. So, some new gloves on. Mm-hmm. Okay, so what I want you to do is just relax, and I'm just going to take a quick listen to your heartbeat. Okay. Very good. Okay, great. Great. Okay, so while I have the stethoscope out, I'm going to also take a little peek at your lungs and see how they're going. Yes. Yeah. Okay, one second. So you're going to take some big, deep breaths for me. Okay, fantastic. And in and out. In and out. Good, and a couple more of those. Great, great. Okay, I'm just going to go around to your back, and I'm going to do it at your back as well. Okay. And in, Great. And out. Good. In and out. Fantastic. No, everything sounds absolutely great. Yes. Yes, so nothing to worry about there. Okay, so let me just get on with the questionnaire part, and then I'm just going to take your fever, check your temperature for fever, and we'll be good to go. Yeah, okay. Just this. All right. Have you ever had asthma? Okay. Emphysema? Chronic bronchitis? Have you ever had tuberculosis? Okay. And have you ever been told that you have disruptive sleep apnea? Okay. Any other chest diseases that we should know about? Okay, perfect. Perfect. Yeah. Yeah, I know there's a lot of questions, but it's for your own safety. Yeah, let me just... Okay, there we go. All right. Okay. All right. Have you ever had a thyroid problem? Okay. Diabetes? Okay. Kidney? Okay. Bladder or urinary problems? Okay. Liver disease? Okay. Excessive bleeding, bruising, or blood clotting? Okay. Okay. Okay, perfect. All right, have you ever had any of the following? Stroke, muscle disease, progressive weakness, okay, next page, okay, epilepsy, okay. Have you ever had anesthesia in the past? Okay. Okay. And when was that? Okay. And at which hospital was that? Okay. Okay. Perfect. Okay. Do you or have you ever suffered from depression, anxiety, or any other mental illness? Yes, I know it's an odd question to ask at a plastic surgery clinic, but we like to make sure that we screen clients for something that's called body dysmorphic disorder, and that way we can help those individuals go to the proper help that they need, which is not a cosmetic procedure clinic. It's getting more serious help. Yes, so we screen for that. Yeah. All right. Yeah. Okay. Have you ever had MRSA or MRSA? Yeah, don't worry. If you don't know what it is, then you haven't had it. Okay. All right. Do you see your GP or general physician for anything regularly? Okay, perfect. And have you smoked within the last 5 years? Okay. And do you drink more than 3 times a week? Okay. And Do you take any prescription medicines? Okay. All right. And any inhalers? Okay. Do you use any recreational drugs? Okay. And lastly, do you have any allergies? Yep, to anything. Drugs, latex, antiseptics, food allergies, anything at all. Okay. Perfect. Okay. Is there anything you think that we should know about? Okay, fantastic. Great. So. Alright, great. So let me just get you to hop up on the table here, and I'm going to do a couple more things to take a look at your face, and then we'll go over to the procedure room. Great. Okay, great. So I'm just going to take your temperature. Yes, just to make sure that you're all in good health and that you're not going to come down with anything. And then we can go over into the procedure room and get started. Yes. Okay. So I've got my little disposable thermometer here. Yes. And perfect. Okay. Good. Great. Just hold that there. Fantastic. Fantastic. And so I'll go over some of the last minute things that you need to know about the procedure that we're getting done. Perfect. All done. Okay. Looks like you're all good. Yes. Okay. So some things that you need to know about the procedure that you're having done. First of all, there will be slight temporary injection site spots that you'll see where you're getting the Botox done. Those will go away in about 20 minutes. Now, the Botox itself, the results aren't immediate. It takes anywhere from 2 to 7 days for the results to be seen, so I would say by day 10 you're going to see the maximum results. Yes. Yes, so that's when you want to see exactly what you're going to look like with the Botox injections and see how you like it. Yeah. Now with the Juvederm, the results are instant, so you're going to see those right away. Correct. Yeah, so you'll get to see what those look like as soon as you walk out. Yeah. So some of the side effects of both of the injections is that sometimes you can get a little bit of soreness or slight inflammation, and in some cases with the Juvederm you'll get some mild bruising, but that should subside pretty quickly. Yes, if you're in any discomfort whatsoever, you can just take an ibuprofen and use some ice packs and you should be fine in a few hours. Yes. Yes, with the Botox as well, sometimes you can get a headache, but again, you just take an ibuprofen and you should be fine. Yes. Fantastic. Okay. Alright, so I think we have everything that we need from you, and we're all set to go, so we're just going to head down the hall and go to the procedure room. It's got lots of bright lights and it's a bit intimidating, but we're just going to do some minor injections and it'll be nice and simple. Alright, great. Okay, follow me down the hall. Okay, fantastic. So I'm just going to get my gloves on and we'll get started. There's nothing to be worried about. Okay, so first what we're going to do is I'm going to take out this topical anesthetic. what it is if you can see really closely, in here there's liquid. Yep. So what we do is we snap it, and all the liquid fills up in here, and then we apply that to your forehead and to the other area and injection sites, and then you won't feel a thing in about a minute or so. Yeah. Alright. Okay. Perfect. Okay. So now what we're going to do is apply this. Okay. So I'm just going to go here. Okay, and down here. And over here. Okay, a little bit up here. Okay, great. Okay. So now while we let that kind of take effect, what I'm going to do is I'm going to prep the area with a little bit of alcohol and cotton swab rub, just to clean and sterilize everything, and then we'll just get started. Okay. Okay. There we go. And now let me just open the new. Okay. That. There. Okay. Perfect. Okay. Okay, perfect. Okay, now that should be taking effect. Do you feel anything up there? No. Okay. Alright, perfect. So now let me get started. Okay. So now we're gonna just do quick. Right here. And right here. And right there. Good. Good. And now we just need to get the edge of the derm out. Yeah, that's it. It was that simple. Yep, that was all 16 units inserted into the different areas that I thought you needed. Yeah. Okay. Alright. Okay, you ready? Okay. There'll be a slight pinch, and you might feel some coolness under the skin. Okay. Right, here we go. Okay. Perfect. And just on the other side here. Okay. Just gonna get this. Okay. Okay. There we go. All done. How do you feel? Great. Well, I'm glad that we could be of service. Let me just take some gauze here. Yeah, sometimes you just get a little bit of blood spots where the injection sites were, so. Great. Okay, you're all set to go. Yeah, have a great day.